The way you do this is you grab this suture needle with your needle driver, in this case the Leatherman Squirt P4, and you just pull up and out, and you now have it. All right, let's go over the materials in the kit. So we open up our kit. We've decided we're going to need to use sutures. We're going to pull out our irrigating syringe. We're going to pull out suture material. And yes, we're going to pull out gloves. And for demonstration purposes, we're going to pull out some betadine. Let's go over this kit. This is the irrigating syringe. I've kept these items in individual 3x5 Ziploc bags. They make it easy to store in your aid kit and make it easy to pull out individual items. This is simply a 5cc syringe. To be honest, it's a compromise. Ideally, something on the order of a 20cc syringe or larger is optimal, but in all practicality, not something you're going to have out in the field. So a 5cc syringe. I've left the protective cap in place. I've modified it by taking a hot paper clip and poking a hole in the end. If you can get a hold of an 18 gauge needle, that also will work as an irrigating tip. You can also use the 18 gauge needle for getting splinters out of a finger or other body part. This is my suture pack, and in here we have a pack of suture material, 4-0 monofilament with a large cutting needle. We'll go over that in a minute. In this pack are some other closure options which we can talk about in a future video if anybody's interested. There are steri strips and super glue. I also keep a razor blade in here. This is perfect for cutting any material that you have. So we'll use that when we get into the suturing. This is a pack of betadine. It's about 3/4 of an ounce. This is perfect for field use, and this actually makes a lot of betadine. I'm going to open up the top and put it in a canteen of water, and we're going to make a dilute betadine solution that we'll use as a wound irrigant. Again, this is used only for dirty, contaminated wounds. The last little bit of kit is 2 pairs of protective gloves. Trust me, if you get to the point where you decide that you're going to suture, you're going to want gloves. This is a little bit of a messy process, and if you've never done it before, it's even more messy, and you're doing it in difficult conditions, and there's blood exposure. So do yourself a favor, throw a couple of pairs of protective gloves in your first aid kit. It doesn't take up much room, and it's a great item to have. All right, we're getting set up to suture. We've got our gloves, suture pack, betadine if we need it, irrigating syringe. Let's spend a moment on the irrigating syringe and the betadine solution. Again, remember I mentioned that cleaning is fresh water, so irrigate the wound with plenty of fresh water. You can take your camp cup, dispense a small amount of water, we'll save the clean water for flushing. The water that's in our cup is going to be used for making a dilute betadine solution. Just simply tear the corner, keeping it vertical. All the betadine will go down to the bottom, and put just a squirt of betadine in that water. That should look like dilute tea. And you'll notice that this pack has plenty of betadine, more than we actually need for managing this wound. Let's take a look at our field expedient irrigating syringe. Remember, this is a 5 cc syringe. The protective cap is in place, and there's a small hole bored in the end of that with a hot needle. You just put that in that cup, draw up the irrigating solution, and irrigate directly into the wound with that. And because it's a small syringe, you're going to have to do it multiple times, but most of these cuts are going to be small to medium in nature, and you just keep irrigating under pressure directly into the wound, perhaps 2 or 3 fingers off the wound. Multiple irrigations, and again, when you're done irrigating with betadine, you then go to your fresh water. Irrigate out that betadine. And remember, the betadine is used only for dirty, contaminated wounds. In general, most clean wounds can be irrigated with just plain water. I would put the water in my cup and use the irrigating syringe with just plain water. All right, we've gotten down to the crux of the matter, and we're ready to suture. You put on your gloves, pick up your suture material, and now I've got a question for you. How do you use that? Have you ever opened one of these? And what are you going to use to drive the needle?